Hello everyone, welcome to my YouTube channel. Are you at the 13th week of your pregnancy and you clicked on this video? Do you have concerns about your pregnancy or want to learn more about your baby? Don't worry, you will learn all the changes about your body and baby in this video. If you are wondering what awaits you in the 13th week of your pregnancy, I recommend you to watch at the end. Let's start. What will we talk about in this video? Let's check the titles together. Changes in your body, symptoms, belly, things to do, baby size, baby development, baby ultrasounds, and gender prediction. Let's start with the first topic. Changes in your body. Welcome to the most enjoyable and comfortable part of your pregnancy. At the 13 weeks, now you are entering your second trimester. Good news, miscarriage rates greatly decrease after the first trimester. In the 13th week of your pregnancy, your belly continues to expand up and out of your pelvis. Your waist size changes now and your clothes start to get narrower. The need to wear more abundant, comfortable clothing increases. In some pregnant, sexual intercourse may be more enjoyable than before, because increased blood in pregnancy also increases the amount of blood in the genital organs. However, many women experience the opposite of this situation. The most important reason for this is that women do not find themselves attractive while pregnant. Skin problems may continue during the 13th gestational week. Pregnancy masks, which we call closma, which causes dark spots on different parts of the body, can be seen on the face. This condition is usually temporary and resolves after birth. Your gum bleeding continues during the 13th week of your pregnancy. Brushing your teeth regularly makes you comfortable. Always use organic toothpaste without fluoride during pregnancy. Symptoms. Please comment below how many kilograms you gained in the first 12 weeks. It may be appropriate to target 2 kilograms in the first trimester, but most women do not gain weight in this first trimester due to nausea complaints. You may have observed that your vaginal discharge is increasing. This is completely normal, will continue to increase throughout your pregnancy. The discharge is due to the increased estrogen and accelerated blood circulation in the pelvic region. It has an important purpose: to protect the birth canals from infections and balance the number of healthy bacteria. Your breasts are also changing. The average breast tissue weight before pregnancy is 200 grams. The weight and size of the breasts increase while pregnant. Towards the end of the pregnancy, each breast can weigh 600 grams. During breastfeeding, the weight of each breast is 800 grams or more. As early as the second trimester, you start producing colostrum, which is the precursor to breast milk. Colostrum is yellow and sticky. You may notice your breast leaking from time to time, but unless you have pain or discomfort, it's a perfect normal part of pregnancy. As the breasts change, you may notice that the veins under the skin become clear. Still cravings? Not all moms-to-be have cravings. If you have cravings, that's normal. Cravings can be triggered by hormonal changes in your body affecting the taste and smell. You feel like you're bloated, full of gas, and ready to explode, right? Because the disorder of bowel movements is a complaint that you will regularly experience during pregnancy. Constipation and gas problems during pregnancy are the most common causes of bloating. The level of progesterone circulating in the body while pregnant causes the smooth muscles in the large intestine to relax and thus causes the food to remain longer in the digestive system. This is the reason for constipation that causes bloating and gas. All these problems are related to each other. A few tiny tips to relieve these symptoms. Eat less and divide your meals. Eat slowly. Eating hurry will cause you to swallow air. Keep calm. Tension and anxiety can turn you a gas tank. Avoid foods that make gas, such as fried foods, beans, carbonated drinks, my baby. Drink warm water with lemon and breathe right. Belly. As I said before, our uterus is now big enough that it's growing up and out of your pelvis. That means you are starting to actually look pregnant. Things to do. The diuretic effect of coffee can cause unnecessary excretion of the calcium you take with the meals. Overdose caffeine causes tachycardia, irritability, tremors, and insomnia. Studies on the use of caffeine during pregnancy are that daily intake should be at most 2 cups of coffee. The result is that if you are going to drink it, it will be more convenient to drink coffee 3-4 hours after meals. I'm taking prenatal vitamins. Should I pay attention to what I eat? Yes. Prenatal vitamins can fill a deficit in your daily diet, but cannot replace healthy eating, because prenatal vitamins do not meet the daily amount of calcium you need right now. In addition, consume fresh fruits and vegetables to gain fiber so digestion will be easier and the heartburn problem, which is the biggest problem of pregnant women, will decrease. You should drink plenty of water, be careful to eat healthy foods, and stay away from packaged foods. Even if I don't like the calorie calculation, I want to share it as information. 300 extra calories per day is enough. In twin pregnancies, the rate is for 600 calories per day. Try to eat protein and calcium containing foods every day. Also eat foods containing magnesium, such as bananas, to prevent cramping. Try not to gain excess weight. A pregnant woman gained an average of 2 kilograms in the first 3 months, then gained 6 kilograms in the second 3 months. In the 8th and 9th months, the pregnant woman should gain weight at 450 grams per week and should take 450 or 900 grams in the last month. The belief that the mother who gained excess weight will have a big baby is widespread, whereas there is no relationship between the weight of the mother and the weight of your baby. Baby size. Your baby is growing faster. Your baby is about the size of a lemon in the 13th week. It means 8 centimeters and 28 grams. Baby development. As of the 13th week, your baby's vocal cords are developing. Perhaps the first step of the future strong musician, who knows. His face looks like more a person while working, and the eyes that were separated from each other like a bird were approaching the midlife. Tissue around your baby's head, arms, and legs is slowly fortifying into bone. Your little one has even started urinating in the amniotic fluid. Most of this fluid will be made up of your baby's urine from now until the end of your pregnancy. As of the 13th week of your pregnancy, your baby's liver starts producing bile. The insulin hormone, which is responsible for balancing blood sugar, is also being produced in your baby's pancreas starting this week. Even though their lungs are not filled with air yet, your baby has been working out his lungs by doing respiratory movements since these weeks. So, our baby movements start this week. You have the possibility of feeling tiny movements, but you can still wait a little longer. Baby ultrasounds. Let's look at the ultrasounds of babies in the 13th week of your pregnancy. Gender prediction. Will the baby's gender be determined at the 13th week of your pregnancy? Will the baby's gender be determined at the 13th week of your pregnancy? We know you wonder. In the 13th week of your pregnancy, the external reproductive organs are so advanced that gender prediction can be made. If the baby is not very shy and the baby is in suitable position, when to call a doctor? Always consult your doctor if you experience any pelvic or abdominal cramping, spotting, or bleeding, as these can be signs of miscarriage. Also, it's a good idea to seek help if you are worried about any issues or are experiencing extreme stress. We've talked about the 13th week of the pregnancy. If you have any questions, please comment below. And if you like this video, please like it and share.